really ask yourself, like, say it out loud, write it down. What do you want? And be willing to take risks and have faith in yourself. Because when I was younger and a female, I would say a predominantly male-led industry, especially healthcare leadership, the higher up you get, there's a lot of men, and being authentic. You got to be yourself, because the authenticity is what builds those relationships. People can smell BS a mile away, and be true to who you are and just stick to what you want to do.
You mentioned something really, I think, relevant right now to not only the industry, but to private practices, is that we have a huge population of aging physicians. And a lot of places are scrambling to figure out, okay, not only how do we phase these people out, but how do we bring in a new wave of physicians, and how do we structure those agreements and that partnership opportunity? And that's something that you've been able to do. So I'm curious to hear kind of just the challenges of that and how you've gone about kind of that delicate balance.
Yeah. So throughout my career in the nonprofit world, in the service line world, you'd hear a lot, you'd see a lot. And one consistent theme I would see over and over again is groups either breaking up or fighting, a lot of infighting. A lot of the times it would end up coming back to, how do we bring on young docs? And the docs who were there, some would want to grow. Some wouldn't want to grow because they would be worried about, how is this going to negatively impact me? Are they going to be coming in and then, taking a slice out of my pie?
Right.
Or the younger docs being brought on and as associates, not partners. And that associate model, it ends up being very disadvantageous to the associate, like putting them at, overworking them, underpaying them, almost taking advantage of. So not really treating them like someone who you're bringing on as an associate with the intention of becoming your peer one day. Like, where's the mentorship? Where's the support? Like, they're not just really kind of like the second-class citizen mentality, where someone, if and when they ever actually offered them partnership, it would be a massive buy-in to the company as well. Something, $2-3 million buy-ins. That's how it's always kind of been historically, but times have changed, and also collections have changed. I'm sure I always joke around with some of our older doctors. I say, "Oh, you've got that nice beach house. You had that '90s money. That money. The revenue and the collection and the income of physicians 20 years ago, and today it is like it's different. It's just a different ballgame. So you kind of have to be mindful of what the times are and how possible is it for folks to be doing these massive multi-million-dollar buy-ins. So in addition to trying to treat our associates much better, we have a shorter runway for established physicians to become partners. And what we're looking at, cultural fit and personality, is so important to me. Yes, obviously you have to have quality. That's a given. Top quality and clinical, acumen comes without saying. But what are you like as a person? Because one of the things that I'm really focused on is having the right people on the bus and the wrong people off the bus. So I don't want a partner who's going to be covering for his colleague, let's say doing rounds in the hospital and trashing his colleague to another physician or the patient. No, like that stuff doesn't fly here. I really make it a point to call out those types of behaviors. We take time to spend with one another. Partnership is not just a financial term here. It's really about building the bond between these physicians. We have a quarterly supper club as well, where no business is talked about. Like, it's just to see each other as human beings and not to,
just talk business.
Yes. Because if you're only seeing each other face to face to argue about who took more weekend call, you're doomed, right? So, and we bring the associates to those dinners as well, because they're here to become part of this group. And it's just as important when bringing them on that they feel that they're equitably compensated and valued. And the runway to getting into our group is much shorter than one it would be years ago. I mean, we're looking more at like 18 months. If they're financially solvent and they're a good citizen, like having that vote of bringing them in.
Right.
And without the massive buy-in, we're not doing that. You have to
That's great.
Take a second mortgage out. Come on.
I know, right?
Yeah. And similarly, slowing down process is just as tricky, because when you're a partner, the way that they're paid is their distributions. Every partnership's, there's combinations of eat what you kill, the full socialist and hybrid model. We take a hybrid approach. So what each partner brings in does impact their other partners as well. So how do you successfully unwind them in a thoughtful way so that you're not getting a young versus old battleground of, I put 20 years in to build this group, and then a guy who just graduated fellowship. That's a very hard bridge to to build. Yeah. Because one feels a certain way, and rightfully so, and the other is also very justified in how they're feeling about it. So we're really trying to, one of the benefits of our company, Atlantic Brain and Spine, is we are closely affiliated with Atlantic Health System, even though we're an independent private entity. We are really focused on building the neurosurgery departments and programs with it at Atlantic Health. And, with those healthcare systems, they have very specific needs as well. So we're really trying to see how can we create pathways for our surgeons to provide the healthcare systems with what they need. So, someone who might be older in their career who's looking to slow down, if that hospital is looking to establish a fellowship or a residency program, that might be a great medical directorship. Those are great ways to help get the healthcare systems what they need. We have these resources here. They might not be completely 100% appropriate for private practice anymore, but the clinical, the intelligence, the experience that they can share and bring on while elevating the reputation and brand of a hospital system. It's like, how do we marry those two things together to make a smooth glide path out for someone who has had an outstanding career? I hate seeing someone whose career ends negatively.